What are biomarkers, and how do they advance osteosarcoma treatment? Imagine a tiny molecular signpost inside your body that can tell doctors what's happening at a cellular level. These are called biomarkers. They are measurable molecules found in blood, tissue, or other body fluids that reveal normal or abnormal processes, including the presence of diseases like cancer. In osteosarcoma, which is a primary bone cancer mostly affecting children and young adults, biomarkers are becoming essential tools in improving how we diagnose, treat, and monitor the disease. Biomarkers help in detecting osteosarcoma earlier by identifying specific proteins or genetic changes associated with the tumor. For example, certain proteins like glutathione S-transferase P1 and chemokine receptor CXCR4 tend to be overproduced in more aggressive cases. Researchers are also exploring circular RNAs, a stable type of non-coding RNA, which can be found in blood samples. These molecules could serve as less invasive ways to diagnose osteosarcoma and predict how the disease might progress. One of the most exciting advances is how biomarkers enable precision medicine. Instead of using a one-size-fits-all approach with standard chemotherapy, doctors can analyze the molecular profile of each patient's tumor. This involves looking at the genes, proteins, and metabolic pathways that are altered in the cancer cells. For example, genes like TP53 and RB1 are often mutated in osteosarcoma, and pathways involving molecules like CDK4 or HIF1 alpha are frequently dysregulated. By understanding these changes, targeted therapies can be developed to specifically block these abnormal processes, potentially making treatments more effective and reducing side effects. Biomarkers also help predict how well a patient will respond to certain treatments. If a tumor shows signs of resistance or a poor immune response, doctors can adjust the treatment plan early on. This approach can improve outcomes by avoiding ineffective therapies and focusing on options that are more likely to work. Another promising area is the development of therapies aimed directly at biomarkers. For instance, a protein called LRRC15 is found on osteosarcoma cells. Researchers are working on targeted radiotherapy using antibodies that attach to LRRC15, delivering radiation directly to the tumor. This kind of targeted treatment could be more precise and cause fewer side effects than traditional methods. Monitoring disease progression is also crucial. Circulating biomarkers, like specific circular RNAs, can be measured over time to see if the tumor is shrinking or if it might be coming back. Detecting early signs of relapse allows for prompt intervention, which can be life-saving. Overall, the integration of biomarker research into osteosarcoma care is transforming how we approach this disease. It moves us toward personalized medicine, where treatments are tailored to the individual's unique tumor profile. This shift aims to improve survival rates, enhance quality of life, and develop new, more effective therapies. As ongoing research and clinical trials continue to validate these biomarkers, we can look forward to a future where osteosarcoma treatment is more precise, less invasive, and more hopeful for patients everywhere. Always remember, discussing these options with healthcare professionals is essential to determine the best approach for each individual case.